afternoon, everybody. The Secretary to the Government of the Federation, other ministers, permanent secretaries, directors, visiting member of the National Assembly. I greet you all, and as we mark these holidays coming and prepare for a holiday, we must not forget that we are in the middle of a massive global pandemic which has taken many lives and where the virus will not be taking a holiday. We must therefore not let down our guard, must continue to be as vigilant as possible. Look at the figures of other countries, we shudder and shake. We have been lucky to have been spared such bad figures so far, but must not take anything for granted. As far as our country is concerned, our surveillance and contact tracing and testing capacity is increasing gradually in all states as more laboratories come aboard. I would like to use the opportunity here to call on all our state governors and leaders and FCT to increase the number of surveillance teams and isolation and treatment capacity to keep pace. I was also a member of the, able to take part today at the National Economic Council and have an interaction with their excellencies, in which I had the opportunity to speak also on the COVID-19 pandemic. We have developed more key performance indicators to track surveillance and strategic directions and programs. As of this morning, we have recorded 6,677 confirmed cases in 34 states and the Federal Capital Territory, out of which 1,840 have been successfully treated and discharged. Sadly, we have recorded about 200 deaths in 25 states and the Federal Capital Territory. A finding from the analysis of the death patterns shows 70% to 30% for male and female, around that ratio. And about 70% of fatalities were persons over 60 years old, while majority of positives were between the ages of 29 and 49. Those are the most active ages in life. I also advise those who are taking the test and are waiting result to heed the advisory to self-isolate yourselves in your homes until you get your result. And in order to be able to save your friends and your family, wear masks and observe hand and respiratory hygiene until your result is out, so that your community and those around you will not necessarily be exposed. We are scaling up training of health workers on infection prevention and control, and so infection among healthcare workers is gradually reducing. In Kano, the training has been scaled even to patent and proprietary medicine vendors, and retraining is now a continuous process to be sustained, so that nobody will forget the protocols for this very highly infectious disease. State-level infection prevention and control measures and training are being carried out working with partners and has also been standardized to be stepped down to community level. The fact-finding team of the Ministry of Health that went to Calabar has returned successfully with the report, and we have been able to identify areas of strength and areas that are in need of upgrade, including laboratory infrastructure. The state of readiness of the state against COVID-19 is reasonable, and includes setting up of COVID-19 task force, production of PPEs, face masks, of which samples were presented to our team and will be forwarded to NAFDAC for validation. The areas of strength and weaknesses, as said, are still being analyzed so as to improve federal cross-river state collaboration and support. The critical findings is that no case of COVID-19 has still been reported as at 20th May 2020 when the team returned to Abuja. 16 cases had been tested, of which all were negative, and 28 persons of interest had been followed up, of which none of them presented any symptoms after completion of their 14 days of self-quarantine. And the testing center, there are no other testing centers established in the state as yet. We are going to be working with the state to establish protocols and improve communication and reporting to our reporting centers here in Abuja. Our team in Kano has made a very successful trip now to Gombe on fact-finding mission. After the tour to Borno, the reports from these states are being awaited so that we can streamline the response and provide more targeted support. A new medical team has been assembled to take over the management of the This Day Dome Isolation Center, which was donated to the government by the private sector. And it is a very comprehensive treatment center for second, third, and even fourth level treatment. Has dialysis machines, ventilators, and facilities for waste disposal. Admissions will start at any time now. We have heard of the threatened industrial action in Lagos State among doctors. I spoke with the president of the Lagos chapter of the association yesterday evening to dissuade the doctors from the planned sit-at-home protest that they wanted to conduct. And I also listened to their complaints about harassment at security checkpoints. I communicated this to the Honorable Honorable Commissioner of Lagos State, Commissioner of Health, with the suggestion that he facilitates the issuing of special passes that identify health workers as such to ease their transit to and from work, and also to ease the screening for security officers at checkpoints to be able to identify who is who. It is my recommendation that the same passes be issued to health workers in all states and the Federal Capital Territory to forestall misidentification. I also had the honor of carrying out a similar intervention in respect of medical workers in Federal Capital Territory in the company of Federal Capital Territory Minister under the auspices of the Speaker of the House to reach an understanding over stabilizing the sources of payment of their salary. Our health workers are our foot soldiers, and we shall ensure that they are able to discharge their duties unhindered. In response to a question that was raised the other day about the morbidity pattern, I will say that the comorbidity of the persons, the fatalities we have had to COVID-19, 70% of them had hypertension or diabetes, and then the rest were kidney disease, HIV, cancer, tuberculosis, and others undetermined. I shall remind Nigerians again on the need to adhere to the advisories which I re-emphasize, that masks must be worn and washed daily, and washed, especially when you go out, you must wear your mask, and where possible you iron it, and that the mask should cover mouth and nose and should not be left under the chin while you are having a conversation, as you often see on television, particularly when you are having close quarter conversations. Tissues, as usual, must be used during coughing and sneezing and appropriately disposed of. All other measures that have been prescribed, like social distancing, abstaining from any kind of unnecessary travel, should be adhered to. Any kind of travel from one state to the other carries the risk of transporting a virus, the coronavirus, from a place of prevalence to a place where it was not present. We trust that the collaboration and cooperation of citizens is understood as an important and extremely important part of the success of whatever it is that we're all doing here. Thank you for your attention.